Hi class, it's lecture time. So we're still on chapter 16, and today we're going to talk about electrical therapy. So here we see our heart beating with a pacemaker. So your pacemaker is an electrical device, and it sends out electrical stimulation to stimulate the myocardium to depolarize. Your pacemakers do not force the heart to beat, okay? They work by either speeding up or slowing down the heart or to shock the heart out of an unstable rhythm. What they do is send out an electrical signal, just as a person with a well heart, electrical signal would fire from the SA node. And if this patient with heart trouble, if their heart is still healthy enough, then the pacemaker should, uh, that atrial ventricle should depolarize when the pacemaker fires. And pacemakers are also used for anti-tachycardia pacing or what's called overdrive pacing. Okay, so there's two kinds of electrical therapy. You have artificial pacemakers and you have your cardioversion and defibrillation. With artificial pacemakers, there's two kinds. There's the traditional and there's resynchronization therapy, cardiac resynchronization therapy. And then with cardioversion and defibrillation, it uses a biventricular pacemaker. It paces the electrodes in the right atrium and in both of the ventricles. It improves cardiac output by allowing both the ventricles to contract simultaneously. It requires strict criteria to use. Patient must have severe heart failure with a wide QRS, or they can have a left bundle branch block or sinus rhythm. This can improve the quality of life for severe heart failure patients. So what's the indications for a pacemaker? Sympathetic, symptomatic sinus bradycardia, junctional rhythms, idioventricular rhythms, the dying heart rhythm, asystole, your 2 to 1 AV blocks, Mobic 2 second degree AV blocks, third degree AV blocks, or anti-tachycardia pacing. So you have permanent pacemakers versus your temporary pacemaker. Your permanent pacemaker is used when the arrhythmia is thought to be permanent. There's two components. It has a pulse generator or battery pack and a pacing catheter. And it uses lithium batteries that usually last about 5 to 15 years. And with your temporary pacemaker, it's used to help patients get over the hump, like after they've had a heart attack. There's two kinds. There's the transvenous and the transcutaneous. And both of these require a pulse generator at the patient's bedside. And here we see an example of these. Okay, so you have single chamber pacemakers, dual chamber pacemakers, and biventricular pacemakers. Your single chamber pacemaker uses one lead in the upper or in the lower chamber of the heart. The dual chamber pacemaker uses a lead in the upper and the lower chamber. And then your biventricular pacemaker, which is what's shown here in this illustration, uses three leads. One is placed in the right atrium, one in the right ventricle, and one in the left ventricle. Here's our wires that send the impulses from the pulse generator. Okay, so here's an illustration of a patient with a transvenous pacemaker. The problem with traditional pacemakers are they can cause dyssynchrony or abnormal timing between the atria and the ventricle, in which they don't fire simultaneously. They go one behind the other. Traditional pacemakers pace only the right atrium or the right ventricle or both. but they don't pace the left side. If one chamber is stimulated before the other, it contracts before the other. This can decrease ventricular filling and also decrease your cardiac output. Okay, here's a look at a ventricular pacemaker and the rhythm. You see you have a wide QRS, and this is your right ventricle being paced. And you see you're pacing spikes before the QRS. Little spikes here. However, the rhythm is still a regular rhythm. So here's an example of a dual chamber pacemaker in which you have a lead in the right atrium and also a lead in the right ventricle. And then your cardioverter defibrillator. And here, watch our rhythm and our pacemaker in action. You see when the rhythm starts to go astray and the pacemaker fires to shock it back into a normal rhythm, or back into a sustainable rhythm. All right, so pacemaker terminology. The pacemaker fires, captures, and senses. Firing is the generation of the electrical stimulus. It causes the pacemaker spike on the EKG. Capturing is the depolarization of the chamber being paced, and this causes the P or the QRS following the pacemaker spike. And then sensing is your pacemaker's ability to recognize the intrinsic beat to decide if it needs to fire or not. And this causes appropriate time intervals between the beats on the EKG. So EKG pacemakers have their own code, okay? It's called a 3-letter pacemaker code. The first letter refers to the chamber that's being paced, whether it's the ventricle or the atrium or both, or none. Your second letter refers to the chamber being sensed, okay, whether it's the ventricle, atrium, both, or none. And then the third letter refers to the response to the sensed event. Did it inhibit the pacemaker from firing, in which the pacemaker watches and waits but does not pace until it's needed? Or was it triggered, in which the pacemaker sends out a signal in response to the sensed event? Or does it do both, or none? Okay, so you have what's called your VVI or your triple D pacemakers. And this is an illustration of a comparison between both. Your VVI pacemakers are ventricular demand pacemakers. Okay, they consist of a catheter with both pacing and sensing capability. They're inserted into the right ventricle, and the paces and senses the ventricle only. It ignores intrinsic P waves. It provides two options on the EKG: intrinsic beats only, or your paced QRS with dissociated intrinsic P waves. Your triple D pacemakers are your most modern and most physiologic pacemakers. Okay, they're your universal pacemakers. They pace and sense both the atrium and the ventricle, and it takes advantage of the intrinsic P wave. So the atrial pacer will be inhibited if the P wave is detected, and the ventricle will be triggered to give a QRS if the patient does not have a QRS in the present length of time after that P wave. It's rate responsive, and it's inserted into the right atrium and the right ventricle. So your triple D pacemakers can provide 4 options: intrinsic beats only, paced P waves and intrinsic QRSs, paced P waves and paced QRSs, intrinsic P waves and paced QRS. And here's an illustration of what that would look like on the EKG. Okay, so here's a strip that shows you the pacemaker spike on the EKG. So when you start doing your EKG, of course, you'll want to ask the patient if they have a pacemaker. And if they do, then you'll look for your pacing spikes on the EKG. Here's an illustration of your VVI. And so when the pacemaker, when you have VVI mode, it says if there's no intrinsic ventricular activity is detected, the pacemaker paces the ventricles. So here that pacemaker is going to fire. But if intrinsic ventricular activity is detected, then the pacemaker will be inhibited. So it'll just sit still and wait. Okay, here's an illustration of your triple D pacemaker. And then let's see the pacemaker in action. So number one, the pacemaker generates electrical activity. That electrical activity, the pulse generator catches this activity. And then the ultrasonic pulse is sent to through the wireless electrode that causes the left ventricle to pace. Okay, so in your book starting on page 379, there's some triple D versus VVI practice strips. So let's look at those. This is number one. Okay, so number one would be you cannot tell what kind of pacemaker it is because you don't really see any intrinsic beats. There's no pace beats at all. So you can't tell which type of pacemaker it is. Strip 2. This will be an illustration of your VVI. You see, because there's our pacemaker spikes before our QRS. And you don't have any P waves here, okay? Strip number 3. I'll give y'all an opportunity to look at it and see if you can determine what it is. So strip number 3 will be your triple D. And here we see our pacemaker spikes before the P wave and before the QRS. Okay, strip 4. Strip 4 is your VVI. Because we see here it's only one. You have your pacemaker spike before your QRS. So it's pacing the ventricles only. And then strip 5 is your triple D. You see here you have your pacemaker spike before your P wave and before your QRS. Okay, so pacemakers can malfunction, you guys. They can oversense, undersense, or fail to capture or sense at all. And if that pacemaker fails to fire, some possible troubleshooting things can be the battery could be dead, the connecting wires could be interrupted, it could be oversensed, an artifact, no pacemaker spike where there should have been a pacemaker spike, or results in a pause. Here's an example of failure to fire. You see there's not any pacemaker spikes where they should be. Then you can have a loss of capture, in which you have a lack of P or QRS following the pacemaker spike. The signal may be too weak, or the pacing catheter may have lost contact with the chamber wall. And here's an example of that. You don't see any P's or any QRSs. You just see the pacing spike. Okay, so here's an example of failure to capture. And here we see there's spikes not followed by a QRS. Or you can have undersensing, in which the pacemaker fires too soon, and you'll see spikes inside your T waves for your QRS complexes. The sensor might need adjusting, or you can have fractured sensing wire or battery failure. Here's an example of that. Right here where we see our circles. So here's a little summary of your pacemaker malfunction. Your failure to fire, there's a lack of pacemaker spikes where they should have been, and it usually results in a pause. Loss of capture, there's pacemaker spikes not followed by P waves or QRS complexes. And undersensing, in which you have pace beats or spikes too close to the previous beat. And it often results in spikes inside your T waves, your ST segments, or your QRS complex. So here's a mnemonic to help you guys remember some of your reasons for failure to capture. It's called bedfast. Your B is battery failure. D, disconnection at any point. F, fracture of your wires or cables. S, the settings that may be inadequate. And T for threshold change. Okay, and that's all I have for you guys today. Here's your assignment. You're going to create your reference card or sheet if you don't have any index cards, okay, with your 3-letter pacemaker code. And I will see you guys next lecture. Bye-bye.